Good afternoon and welcome back. Today we're going to talk about vaccines, a pretty hot topic now. And so we want to talk about how many vaccines have actually been given and the side effect profile. I know you've heard a lot of things about the side effects in the news. And then we also want to talk about when will you be able to get the vaccine. So the first thing I want to talk about is herd immunity. And let me just tell you what herd immunity means. That's when there are a significant amount of people in the community that have immunity. And when you get to that point where you have a significant amount, and that amount is somewhere between 60 and 70% of the community has immunity. And at that point, it's very difficult for the virus to be transmitted or to be spread. That is what we're trying to get to with this vaccine, because with the infection, with people getting infected with the virus, we've only got about 10% of the community, 10% of the United States that's immune to the virus. So that's a very low number. And if we're going to get to the point where we get herd immunity, that 60 to 70% of the people are immune, we have a long ways to go. And that's where this vaccine becomes very, very important. The United States has been given about 1.2 million dosages of the vaccine. 370,000 have come to Ohio, and to date, as of December the 24th, 11,000 people have been given their first dose of the vaccine. So far, so good. We've had no severe adverse reactions, and we're doing okay. I'm sure by today's December the 26th, I'm sure that there's been more people that have received the vaccine. But as of the 24th, there was about 11,000 people in Columbus, Ohio that had received the vaccine. Okay, so when we talk about who is going to receive, because I know everybody's wondering, well, when can I get the vaccine? We've had calls to our office. Is the vaccine available? Are we going to be giving out the vaccine? So let me tell you how they have this arranged. So there are three phases, phase A, phase B, and phase C. The people that fit into phase A or 1A are healthcare workers and long care facility residents. 1B is people that are 75 years and older, and then also frontline essential workers such as first responders, teachers, postal workers. Phase 1C includes people that are 65 to 74 years old, 16 to 64 with comorbid conditions such as diabetes, kidney disease, cancer, and obesity. And then the last group in 1C would be essential workers that are not included in 1B. Okay, so let's talk about the side effects, because I'm sure that people have heard all kinds of things about the side effects. And so I really want to talk about what to expect with this vaccine, because I think that we need to really be transparent, because people that experience the side effects and then they go and they tell other people, well, I had this and I had that. People can get real leery and they can get afraid that, oh, if I have a headache or if I have a fever, then that's not a good thing. The reality of this is that, according to the FDA, people will experience a headache, fatigue, fever, chills, muscle pain, joint pain, and that goes on a continuum. Some people experience mild symptoms, just like when you get the flu vaccine. Some people experience very mild symptoms after the flu vaccine. Some people can experience a moderate amount, and so with this vaccine, it's the same thing. these symptoms only last for 24 to 48 hours, and then they're gone. You're good. And so I want to make sure that people understand that to kind of anticipate these symptoms, that you're not having an adverse reaction to the vaccine, but your immune system is being jarred or triggered when you get the vaccine. And that's common when your immune system is responds to a vaccine. So the important reason why I want people to know these things is because people are going to come back and say, I experienced this, I experienced that. And I want you to know exactly what to expect when you get the vaccine. There's a second dose, both with the Pfizer and the Moderna. You get a second dose of the vaccine 2 to 3 weeks later. And the symptoms can be a little bit more severe than the first. And so you can have a little bit more muscle pain, a little more joint pain. But again, it only lasts for 24 to 48 hours, and then it's gone. And then you're protected against this COVID-19. And again, I want to go back and remind people that why we're doing this. We're trying to accomplish, or we're trying to obtain herd immunity, where 60 to 70% of the community is immune against the virus. And the only way that we're going to be able to do that is with the vaccine. Because now with the infection, when people getting infected, we've only gotten to 10%. So this is where the vaccine is going to be real valuable to our community, and also getting us through this whole pandemic that we're going through right now. There are some adverse reactions that occurred in the clinical trials. So out of the 70,000, and I'm combining both trials, there were 44,000 people that were in the Pfizer study, and there were 30,000 people that were in the Moderna study. And so out of the 70+ thousand people, there were 4 people in the Pfizer clinical trial that experienced Bell's palsy. And that's a weakening of the muscular on one side of the face. 4 people out of 44,000. And in the Moderna, there were 3 people that experienced the facial paralysis or facial weakness. It's transient, but that's a pretty significant side effect from the vaccine. But remember, 70,000 people and only 7 people experienced that. That's a pretty low probability when you think about the fact that there's been 1.6 million people who have died from this virus. And so I think the odds of you, or the probability of you experiencing these adverse reactions are pretty low. And so we want people to get the vaccine. We want to be transparent with all the different things and the side effects that we talked about. Those are transient, 24 to 48 hours, and then these adverse side effects that occurred in a very small percentage of the people. The FDA has also said that a person should look at the components that are in the vaccine, and you can find that on the FDA's site. It tells you everything that's in the vaccine. If you're allergic to any of the components of the vaccine, before you take the vaccine, you need to have a talk with your primary care physician, and I would say that that would be the situation where you would be given the vaccine under controlled medical conditions, because we don't want to have an anaphylactic reaction to the vaccine. People that have had reactions to vaccines in the past, or if you've had a reaction to any kind of injectable medicine, again, you would want to have a talk with your physician, explain to them, what the medicine was, or what vaccine you had a reaction to. And again, we don't not give you the vaccine. We just take extra precaution in that setting. So the last thing I would say is that if you've had allergies to food or different medications, that should not really be a problem. Again, I would talk that over. I would have a conversation with my primary care physician and let them know that I want to get the vaccine. I do have food allergies, but in those settings, I don't think there's no extra precautions that have to be taken. You probably would want to stay for 30 minutes or so and make sure that you're not going to have a response. Most of these side effects occur shortly after you get the vaccine, so that's a good thing. But for the most part, tens of thousands of people have received the vaccine, and people have done well. They've gotten the vaccine, they've had a few of the side effects that we talked about, and they've gone on, and they're waiting for their second dose of the vaccine. And certainly I want to emphasize, if you do have side effects from the vaccine, don't let that scare you off from getting the second dose, because you want to be fully immune to this COVID-19 virus. If you like the content, push the like button. If you have comments, make the comments in the comments section below. And you can subscribe to the channel by clicking the button right there.